This conference will now be recorded.
Welcome to everybody who's signing in. I would like to remind you that the chat function is open. If there were questions that came up between the time you registered and now, please post your questions there. We've got a great panel of experts who I will pose those questions to. So at any time during the session, and I'll remind you as we go, please post your questions there. We're not live yet. We've got another 3 minutes before we go really live. We're just sort of live right now.
I'm trying, Therese. I can't find a solution.
Okay. That will be on my list of things to do. Post meeting.
For our presenters, I am muting everyone as they come in. If I accidentally mute you, I will unmute you right away. Thanks.
Got 1 more minute. Okay, we're at the top of the hour. We can get the show started. Welcome to the Best and Brightest COVID-19 National Town Hall. My name is Therese Marie Smith. I'm the Director of Education and Programs with the Best and Brightest Programs and sister company Mish Business. I will be today's moderator, and I'd like to thank each of you for joining today's discussion. This is the 3rd installment in a series of national town halls that we've hosted to address COVID-19 related topics. As you know, within the last 2 months, our organization has pivoted completely to meet the changing and changed needs of our community. And what that looks like to our winning companies, to our champions, to our sponsors, and to all of the companies that we call clients is this. We're focused on providing education and connecting you with resources and information that will help your business get through the COVID-19 pandemic. That's across all our brands, and it's across all of our national regions. So again, welcome. Before we get started, I do have a couple of housekeeping items. Our town hall today has been approved for 1.5 continuing ed credits with both SHRM and HRCI. In order to receive your credit, you'll need to fill out a survey that's going to be emailed to you following today's session. So be sure to fill out that survey and return it so you can get your credit. Also, you will all be muted today during the town hall, but we definitely want to hear from you. We're going to dedicate specific time at the end for Q&A, but throughout the 90-minute session, please use the chat room and ask any questions that emerge as they emerge. If it's something that we need to have handled right away, we will do that. So please keep your eyes on the chat room. So with that, I would like to introduce our speakers. I want to thank our speakers. We've got a very powerful panel of experts here who are going to share their knowledge, drawing from real-time experience, and they're going to offer a real deep and real wide perspective on safe return to work matters. Two of our experts are occupational safety and health legal experts who will share the why of the regulations, how to mitigate risk. Our third panelist is a seasoned safety and health expert and consultant to corporations who will talk more about the how, the application of regulations in an operational sense, and the development of policies and best practices. So we think we've got a great panel for you today. And with that, I'm going to give you some biographical information of each, and then we'll start the questions. First, welcome to Karen Tynan. She's an attorney in the Sacramento office of Ogletree Deacons. Her specialty is workplace safety with an emphasis on OSHA defense, which includes advising employers on compliance, also working with companies during accidents and fatalities to manage the regulatory investigations, and in litigating OSHA citations. She works with a broad range of national and regional companies, including heavy industry, entertainment, healthcare, construction, manufacturing, and she even mentioned poultry before we got started today. In addition to her legal work, Karen has been a community leader in Northern California, working with nonprofits and schools. She's also the founding counsel for Committee for Equity in Women's Surfing, which brought prize equality to women's surfing in 2019. Welcome to our panel, Karen.
Thank you.
Next, I'd like to introduce John Kuning. John is the Director of Manufacturing Excellence with Express Employment Professionals in Grand Rapids, Michigan. He has a passion, and he's put his passion and 30 years of manufacturing to work, working for companies by providing both classroom training and on-site consulting and training in all areas of manufacturing. And in the last few months, that consulting has pivoted mainly into occupational safety and health amidst the COVID crisis. He has extensive experience in lean manufacturing theory and implementation, and has served multiple industries as supervisor, lean leader, product launch leader, production manager, plant manager, director of manufacturing. His goal is to develop better leaders, engage workers, lower costs of goods, and create higher profits for companies by arming teams with the tools that are necessary to be great agents of change. John's favorite place to be is on the plant floor, working side by side with teams and leaders to find solutions to manufacturing questions. Welcome, John.
Thank you. It's my pleasure.
And last, we have Travis Vance. Travis is a member of the Fisher-Phillips COVID-19 Task Force. It's a cross-disciplinary team of attorneys dedicated to advising employers on the many workplace law aspects of the global coronavirus pandemic. He's a partner in the firm's Charlotte office and co-chair of the firm's Workplace Safety and Catastrophe Management Practice Group. He's tried matters across several industries, including disputes and matters prosecuted by the Mine Safety and Health Administration and OSHA. He uses unique or outside-the-box approaches to counsel employers and owners on all aspects of employment law and the development of preventive policies and procedures to avoid employment and workplace safety-related claims. Travis handles litigation in both federal and state courts, as well as claims pending with state and federal agencies, including EEOC, OSHA, and the Department of Labor. He's also assisted clients in OSHA matters pending in 33 different states. He's emerged as a thought leader in the field of workplace safety, and his writings and interviews have been featured in some premier publications such as Inc., Bloomberg Law, Business Insurance, The Washington Post, EHS Today, and The Wall Street Journal. Welcome to our panel, Travis.
All right, thank you very much, Teresa. It's nice to be here.
I'd like to ask each of our panelists to take a couple of minutes and just give us an overview of what you see happening right now, kind of a 10,000-foot view with the clients that you serve, the themes that seem to have arisen due to COVID-19, And then after that, I'll go into some more specific questions. But I'd like the audience to hear your context, where you're coming from, and what you'd like our group to walk away with. So with that, I'm going to start with Karen. Could you please start us off?
Hey, thanks. I'm so happy to join Travis and John on this panel. I think some of the key takeaways and themes that we're going to hear today are that for employers and professionals, there are no new regulations with 26 subparts that you have to understand, parse, implement. What we have is our workplace safety framework, the regulations that are in place now, whether it's the general duty clause or, for example, in California, we have an aerosol transmissible disease standard for healthcare. So in that framework of the regulations we have now, we have to address COVID as a new hazard, as a new biohazard. For me, if I could share a little bit about my typical day, I think it tells a lot and informs our audience. Some of the main industries that are facing a lot of scrutiny now are the healthcare industry, including memory care facilities, any service provider around healthcare. Also, the grocery business, the food chain. We're seeing some complaints, especially for those that have to interact with the public where they may have COVID exposure. And then lastly, meat processing. For example, I was just in a judicial settlement conference a week ago, and the judge said to me, you know, gosh, I know you represent some meat processors. I think your clients have an image problem, which was very telling to me. So that kind of lays the framework for what we're going to talk about today. That's what I'm seeing happening. On the West Coast, a lot of the inspectors, compliance officers have been working remotely and have only been going out on fatality and accident investigations. And so there's a bit of a backlog, and we're going to see more inspections. We're going to see those inspections in the pipeline towards citations over the, I'd say through the remainder of 2020. And I hope that today in our discussion, we can help you understand how to deal with that, how to document your processes, and how to be compliant so you can have safe workers.
Great. Thank you, Karen. John, I'm going to turn it over to you. Can you give us a snapshot of what you're seeing happening right now with your clients?
Sure. Good to be with you all this morning. Travis, Karen, nice to meet you virtually. And, glad to sit down with you. Trees, good to see you again. You know, at Express Employment Professionals, we are a workplace solutions provider. We're a staffing company first and foremost, and this franchise in Grand Rapids also has a training division, which gives us that opportunity to be in a consultative kind of situation. But we do get to pick up information from across the world. We have franchises all across North America, South Africa, New Zealand, and Australia. So we get a really big snapshot of what's going on in the workforce. And the unique thing that we have at Express is we get to hear from the workforce, and we get to hear from the workplace. So we get to hear from the worker going in, and we get to hear from the client trying to bring the workers in. So we really do have the opportunity to see and hear both sides of the equation on what it looks like and feels like. The number one thing we've been hearing and really sensing over the past couple of weeks as states and areas begin to kind of ramp back up and start thinking about coming back into the workforce, those who have been under stay-at-home orders, as we think about coming back into the workplace, the big question that we've been hearing over and over again is how. It always boils down to that one word. How do we do this? And the other side of the equation from the employee is how do we feel safe and confident that we should be returning to work and what's going on at the workplace in order for us to do that. So I think the biggest sense we've been hearing is that. We work, our clients, a lot of them, you know, similar to Teresa, you know what the client base looks like. A lot of small to medium-sized companies, they don't always have the resources, the human resources. They don't have the legal teams and the resources to deal with what that all looks like. The information that comes at these smaller companies is just overwhelming, and where they pick that information up can either be true or not true, or almost true or partially true. And we really do work with our clients to try and sort out, what things we should point back to and how to create that safe work environment. So I think that's been the main gist for us the past few weeks is dealing with that. Not only bringing, restaffing companies, and that's a big part of what we do, but also how to do that safely and how to do it well.
Great. Thanks, John. And Travis, I'm going to turn it over to you. What themes do you see emerging?
Well, thanks, Teresa, and I appreciate Karen and John for this opportunity to be on the panel with you guys. And I think just like Karen said, we're dealing with sort of uncharted territory. We've got framework with respect to OSHA and CDC guidance. And just like Karen said, I think to sort of walk through what I've seen over the last 8 weeks kind of helps the attendees sort of understand what we're going to talk about today. So back at the end of February, which feels like about 6 years ago, I was at our firm's Inside Council conference, and they polled the attendees, tomorrow morning we can do a special session on the coronavirus. Does anybody want to hear that? Everybody's hands went up. I was the only safety attorney in the room, so that meant I was going to stay up all night and come up with a presentation about this coronavirus. And so I did the presentation the next day, and since then I've done about 28 of those and talked about 550 different clients about COVID-19. And it started off with travel restrictions and other issues that would, be facing the employees and the employers at that point. And quite literally, I'd have to throw out my presentation and adopt a new one each week between February and now. And so that kind of gets us where we are today. And before I get to sort of the legal issues, I will say one thing that during the last 8 weeks has been steady the entire time, really has nothing to do with legal requirements. And I think it's very important for attendees to remember these two things in addition to the laws that we'll talk about. And that's one, that every decision that you make during this pandemic, you've got to consider employee relations. How's it going to be received by the workforce? How are employees going to respond to the decisions that you make? And you got to think about public perception. You heard Karen talk about certain industries that quote unquote don't have a good image right now. But during this situation, there's a lot of eyeballs focused on workplace safety. And if you make a bad decision, it could impact you a lot more than other decisions that you may make in the workplace. But having said that, with that backdrop, I think, reopening, like John said, putting employees back in the workplace, reopening plans are a big one. And just more specifically, confirmed cases or suspected cases. Unfortunately, everybody on this call is going to have a suspected case or confirmed case of COVID-19, and having a plan in place on what to do when that happens. And then the temperature screening, symptom screening. If you're a bank or accounting firm or a law firm or some sort of professional service, you've never dealt with OSHA regulations likely in the past. And now we're all in this together, and safety's never been more important. And it applies to every workplace, whether you're in a poultry plant or in an accounting firm. Workplace safety is crucial, and it's going to be that way for quite some time.
Great. Thanks, Travis. And thank you all three for giving an overview. Again, I want to encourage everybody who is listening to use the chat function. If there are any questions that come up as our panelists are talking, please type them in the chat area. We'll either handle them as we go, or we'll handle them at the end during our Q&A session. I'd like to start out, Karen, I'd like to ask you a question. This whole idea of creating a safe and healthy workplace is intimidating in and of itself, as Travis just said, especially for companies that are not accustomed to having to focus on this. But creating a safe and healthy workplace that's in compliance with regulations and then put COVID into the mix, it's overwhelming. What's the good news? I mean, what can you offer to people to give them a little encouragement?
Well, the good news is that we have so many resources. Before this town hall, we were talking about how there's new information from CDC, updated guidance on an almost daily basis. Fed OSHA and state OSHAs are putting out checklists that employers can use. It's almost like ready-made free materials for employers. I think that is the good news. Also, if you think about it, on May 1st or about that time frame 3 months ago, we didn't know nearly what we know now as far as how to best deal with this, how to best address this, and especially for newer companies that haven't typically dealt with big workplace safety issues like financial institutions, maybe retail stores. This has been new and a little bit of a steep learning curve, but think about all the materials you have, OSHA consulting, OSHA guidance that's there for you, and really being able to use virtual platforms. I know Fisher Phillips, Ogletree, all these big firms have created COVID-19, I'd call them resource centers for employers, recognizing that this area of workplace safety is part of employment law, and we have to have the information. We have to be able to address it now. And so I think that for the listeners, knowing how many resources you have and all the materials should be a little bit of a comfort in addressing COVID-19.
And you had mentioned when we talked prior to the panel that OSHA regulations, COVID OSHA regulations, there aren't any. Is that right?
Right. So there's no Fed OSHA COVID regulation. And so what we're doing is whether it's the general duty clause or a regulation about personal protective equipment, we're applying that to COVID-19. And I know Travis probably gets calls, and John, you're asked this question a lot about PPE, and there's been this conflation of terminology with face coverings, face mask. What's an N95, and can my employees wear an N95 under a face covering? All these unusual questions. Sorry, I got the ball for the dog, so she'll stop bothering me. So all of these questions, and I never thought we'd have so many questions about face coverings, and I think Travis probably gets a ton of it too, where we used to be the safety nerds. Nobody really hung out with us at the cocktail party. We weren't interesting. We didn't have fun stories, right? But now we are the belle of the ball because we have this information and this expertise that so many people want. Is that right, Travis?
Yeah, but I think we've always had good stories. But you're right.
Any other thoughts on that, Travis?
Sort of figuring out, man, this OSHA stuff's pretty complicated, but It's been interesting to be an OSHA lawyer during a pandemic. I can tell you that.
Sure, for sure. Let's talk a little bit about the potential for safety and health claims, lawsuits, complaints for non-compliance. That's got to be top of mind for employers. First, let's talk about what sorts of complaints or claims are you seeing now? Let's start with you, Travis, and then we'll move over to Karen.
Okay. Well, I've always sort of broken down the claims into 3 different buckets. The first bucket is really the OSHA bucket, which includes, if the employee has a concern, they can call OSHA and lodge a complaint and say, our workplace is not safe, no face coverings, no social distancing. OSHA has really been responding to that with what they call a request for a rapid response investigation. You get a letter in the mail, you put together a response and say, here's the things that we're doing. Of course, as an employer, you want to make sure you're doing those things and you have a program in place, because if OSHA asks you what you're doing and you're not doing it, then you certainly can't lie to the government. So those are complaints. They're doing some on-site investigations, but as Karen noted, those are generally fatalities, major accidents, or if you've got a letter from OSHA and you failed to respond to it, they may decide to come out. Not seeing a whole lot of on-sites outside of fatalities and investigations. So you've got OSHA complaints, OSHA inspections, and then you got whistleblower claims. So I'm notorious for calling the bad actor employee Johnny. So we'll talk about Johnny all day today. So if you fired Johnny because he complained about social distancing or sanitation, he could file a whistleblower complaint against the company and say, I was retaliated against because of the complaint I lodged. So those are types of complaints we're seeing in the OSHA bucket. The second bucket is the workers' comp bucket. Workers' comp, some states, they say if you work and as emergency responder and get COVID-19, it's presumed to be work related. Some states are sort of changing the burden as to whether the employer has to show it's work related or not. Some workers' comp carriers are going to deny those claims because they think they're not work related. But just be prepared for those types of claims. And, if you're defending a claim to say it's not work related, you can say, look at all the things we're doing to keep people safe. There's no way they got it here. Here's what we're taking, the steps we're taking when we have a confirmed case. Along the same vein, we're seeing a lot of, claims where employees are suing their employers directly, which is unusual because usually you're barred by workers' comp for claims against your employer. But plaintiffs' lawyers are getting creative and making claims of willfulness and intent. And I've even seen some complaints of, intentional misrepresentation and negligent misrepresentation because they told Johnny there was a safe work environment and that was a lie. So that's the type of claims that we're seeing directly against the employers, but they're still in the workers' comp bucket because most of the time they're covered by workers' comp. But just be aware they could go outside of that, even though it's unusual. But you still have to have that program in place, the COVID-19 response plan, social distancing measures, sanitation measures in place so you can defend those claims. And then the last bucket is the third party liability, which would include premises liability. Somebody comes onto your property, they contract the virus because you're not keeping it clean, you're not putting people in masks when you have to, or you're not keeping people apart. Maybe you're not screening people when you're required to do so. And certainly, usually there's no cap to those claims and you can face much higher exposure there. So a lot of different types of claims, but they all come back to the premise of having a response plan, having training, having these practices in place to keep people safe. And if you're not doing that, you should go ahead and start doing that because frankly, unfortunately, everybody on this call is probably going to get one of those three types of claims before the pandemic's over.
Mm-hmm. John, I'm sorry to interrupt, Karen, but I'd like to make sure that John can comment from the perspective of what have you seen employers doing to mitigate some of these risks?
Yeah, I couldn't agree with Travis more. This, and we're going to talk more about it as the hour unfolds here. I think, but part of it is the planning part of it and being prepped and having your return to work post-coronavirus plan in place. And it really, you asked Karen a little bit ago, what's the good news of all this? Well, one of the good news really is it's brought a new awareness to how to create a good safety plan and what that looks like. And this is really one of those cases in my mind that to create a plan and put it on the bookshelf and let it collect dust is really not going to do anybody any good. Even claims we have to show some assurance to our employees coming in that we've got a plan in place and we have to be able to defend what we're doing. Not only with a plan that we wrote, but a plan that we follow. And I think it's become more crucial every minute.
Got it. Karen, what did you want to add?
With what Travis is talking about, I think a big theme I'm seeing across the country is in workers' comp, so your employee with a claim about COVID, and this is what happened also in California, was the governor by executive order announced a rebuttable presumption that if you were an essential worker and you were working outside your home from March 19th to July, I think 7th, it was a rebuttable presumption that you got COVID in the workplace. In California by executive order again, Governor Newsom extended the statute of limitations for Cal OSHA citations, giving inspectors an extra 60 days because they haven't been able to get out in the field. I was on a call last week, kind of a webinar also, and one of these sheriffs from the Midwest was on the webinar, and he's the sheriff that had shut down one of the meat processing plants. And I really came to understand that if there is a void, if there is a perceived void or vacancy around safety, it will be filled by something. It will either be filled by the sheriff, filled by a labor organization, it will be filled by complaints to OSHA. It will be filled by something. It will not just remain. And yeah, you're agreeing, Travis, right? So
yeah, to help in the health department too. You see the health department working with OSHA, and a lot of times the health department's got more power than OSHA does.
Right, and businesses can be red tagged, just a lot of that. So kind of what I ended up on that call, and after listening to the sheriff, and the sheriff had never even been in a meat processing plant, and the first time he went in, he went in because members of his community said, gosh, OSHA's not responding. We can't seem to make any headway with our employer. Can you help us, Mr. Sheriff? And that's what happened. And it goes back to, I can't remember whether it was John or Travis. I think it was Travis talking about perceptions and how you're going to look, your company's reputation. And I think that once your reputation, once you've been in the news, once there's a video of your workers having to work shoulder to shoulder and not social distancing, you can't unring that bell. That's a law school cliche. You can't unring the bell. And so you're stuck with that. And with John, where the rubber meets the road is really implementing. I think implementation is a key word. So many people in the last month have said, hey, do you have something off the shelf for COVID? Well, you know your business best. You know what your customers do. You know what your vendors do. You have to address COVID. There's not some off the shelf 5-page thing that you can put in a workbook and, say, oh, I'm done. Would you agree, John? I mean, I think that's it, you probably see that too. And I think it's important to understand the burden on employers and how custom COVID-19 measures need to be.
Yeah, and you're right, because it's so different across, every industry, and not even across every industry, but even every office or every plant or every factory or whatever. When you walk into a manufacturing plant and one of the first things we talk about is, let's look at and create the personal distancing, which is still the number one thing we need to do. And the manufacturing plant itself, or the floor, the production line is set up shoulder to shoulder, and that's the way that particular line works. So not only do you have industries having to create their plan customized to what they do, they're even having to start to customize what they do in order to fit into the requirements of the CDC requests and the executive orders that have been issued. If you're starting from, well, let's just document what we do, but what you do doesn't fit the guidelines, you have to change what you do before you even document what you do. So when we talk about, in the world of OSHA and the world of ISO and all those things, say what you do and do what you say, both things are being reinvented and customized by our clients every day.
Thank you. I wanted to ask next a question that's come up in a lot of our human resources peer groups that we have across the country, and it's about the recording and reporting of COVID-related incidents, injuries, occurrences. And I want to specifically give this to Karen and Travis. Can you talk about some of the nuances involved in terms of what does an employer have to report? How do they have to report it? Can you speak to that?
Yeah, I think this is a question Travis and I are getting a lot now about recording and reporting. And I think the cornerstone for the professionals who have to deal with recording and reporting is to make your good faith determination of whether or not a COVID illness is work related. And FedOSHA put out some guidance. I think it was it last week, Travis?
It was last week. It went into effect on Tuesday.
Yeah, and that's been helpful. And so I encourage people, I don't know, maybe we could get a link up, Therese. I know we have the ability to do that for the FedOSHA reporting guidance, and that's incredibly helpful. Yeah, and that's going to be for the kind of HR professionals, safety professionals, recording and for your OSHA 300 log. And then as far as reporting, really, and Travis, we usually, when we're advising employers, we're dealing with workplace accidents, amputations, that are very easy to say, okay, the person's in the hospital overnight, right after they cut their thumb off, you know, and we go along. But illnesses create a lot more difficulties. Do you think so, Travis?
Yeah, and I think you know, the first guidance was April the 10th, and it basically said if you're in healthcare, emergency responders, or correctional institutions, you've got to do sort of an investigation, a deep dive. If you're outside of those three, then you just have to, if you've got objective evidence readily accessible that it's work related, you need to record it on your 300 log. The new guidance basically says that the investigation, work related investigation, applies to all industries. But basically, you need to ask the employee, you know, where do you think you got it? Take a look at whether the employee worked around someone else that had it, or maybe they interacted with the public, or someone else in the workplace and contracted it. And then you ask the employee if there's anything non-work related. Maybe they were at a barbecue the weekend before, they got a family member, and you do that investigation. And if it, I just did one yesterday with a client, it turns out it was not work related, but they just want you to walk through a pretty short process to see if it's work related. With respect to reporting, Karen, I think you bring a good point. I know they have different requirements in California, but from a Fed standpoint, you know, I tell folks there's very few COVID related hospitalizations that will be reportable to OSHA. They could be recordable, but not necessarily reportable. And here's why: is because, just like Karen said, usually we got somebody cutting their hand off or something like that, or they're admitted to the hospital immediately, and it's definitely reportable. But with COVID-19, Johnny, told you I was going to talk about Johnny. So Johnny gets COVID-19 at work. He goes home, but he's not hospitalized for a week later. Okay, that's under the Fed rules, that's recordable, but it's not reportable. And the reason for that is because Johnny has to be hospitalized within 24 hours of the work-related accident or incident. And if he's not hospitalized until, you know, 72 hours later, that's not reportable. That's a little nuance in the rules that a lot of people miss. And I've seen it because a lot of companies are reporting hospitalizations that shouldn't be reported. So just keep that in mind. It has to be 24 hours. Now, if it's a fatality, it has to occur within 30 days. So it's more likely you would report a fatality for COVID-19. But there's going to be very, very few inpatient hospitalizations that are reported to OSHA for COVID-19.
And if I could just add, please document, have a written process, document your good faith efforts to determine recordable or reportable. Document how you gather your evidence. Document your decision making. Is Johnny's boss deciding? Is the HR director at Johnny's facility deciding? Who is making an ultimate decision? And I think that having a good faith analysis and documenting that analysis is going to be incredibly important when you do have an inspection start and the inspector says, now wait a second, Johnny's not on the OSHA 300 log. Now, why is that? Are you trying to hide something from me? What are you doing here? And being able to offer that evidence to support the process made on the ground, probably a process that John, you know, deals with as the safety professional there with the workers. You just have to have it documented. That's document.
Yeah, I agree. And I tell employees, and I was just going to say, I tell employers, even outside of COVID-19, if you have a close call on recording an accident or injury or illness or reporting it, and you decide ultimately not to do it, then document why you decided not to do it. Just like Karen said, because if OSHA shows up, they're looking through your records and they say, why isn't this on here? Then you can say, look, we did a full investigation and ultimately decided it was not recordable or not reportable, and therefore we're not trying to just, you know, kind of ignore OSHA's standards.
John, do you want to jump in on this?
Yeah, everything there is exactly right. You know, when we say document, you know, go after, you know, in the case of the workplace injuries and those kinds of things, you know, go after a near miss with the same fervor that you go after a hit. And it just keeps you, you know, just well documented. And if someone comes to you as the boss in your organization or as the leader of the organization says, you know, I'm showing this symptom of COVID, I'm going to go home or whatever that is, just take those moments to go to your plan and determine what you said you were going to do when that occurs, and then do what that do what your plan says. You know, if your plan says when somebody presents to me with a symptom, we're going to send that person home, we're going to send that person for evaluation, whatever your plan says, that when this thing, because Travis is right, it's probably inevitable for a lot of folks, it's going to happen. What does your plan say? And then follow it and document it, follow it and document it.
I want to jump in. There's a question in the chat. It's a pretty specific one, but it's on this topic from Tammy Ketting. Under what conditions can employers require COVID testing for all employees? And also, under what conditions can they require antibody testing?
Hey, Travis, you want to take that one, and then I'll.
Well, I'll tell you it's, the
That's a hard-
antibody, interesting. Well, the EEOC has guidance on testing for COVID-19, okay? So, you can do that in the workplace under the EEOC guidance. It's almost like temperature taking. We've moved into COVID-19 testing and then antibody testing. There is EEOC guidance on there, and it just says, to be mindful of the fact that it needs to be safe and reliable, and it needs to be approved by the FDA if you're going to do that. Just from a discrimination standpoint, treat everybody the same way. I don't encourage employers that don't have medical staff to just be administering tests themselves. I think you'd probably want to contract that or send employees out. With respect to antibody tests, the EEOC doesn't directly address it, but if you decided to do that, I would make sure that it's safe, reliable, FDA approved, because you don't want to be in a situation where you're doing something to keep your workers safe, but cause a greater hazard because you're using some test that's been peddled out there that's not safe to your employees. So, a lot of companies in the retail space, restaurants, things along that nature are doing the testing, and it can be very effective. It's just that just be careful when you're doing that.
And if I could add, the EEOC does address in some of these directives, this goes back to all this information that's out there. Medical privacy, don't make a mistake with medical privacy when you're getting these test results, and even a temperature, taking someone's temperature is medical information. And so what you as an employer need to do is to have a way to hold these records, hold this information in a confidential way. Just for example, out here in California, our Constitution has a right to privacy, and so there's even enhanced privacy rights in California. So be careful about medical privacy. And then my only other comment with piggybacking on what Travis said is that know what you're going to do with the information, because if you give people the COVID test, what are you going to do for the positives, the negatives, something that's ambiguous? For example, I had a client that did some COVID testing, and they were having to wait 2 days for the results, and their employees wanted to be put up in a hotel while they were waiting for the results before they went back to their families, and they hadn't contemplated that. And so then it was like, well, do we have to put them up in a hotel? Do we have to pay them while they're in the hotel? What do we do? And so knowing all the steps that you're going to take in the temperature process, mapping it out, I think is important, instead of kind of a knee jerk, oh, we're going to take everybody's temperature and figure out who's sick.
Yeah, and I agree. And I think if just like Karen said, I think the number one claim, the biggest number of lawsuits that will come out of this pandemic will be privacy related, because people's biomedical information was not protected. I can see that coming because there's so many clients, customers out there, employers that are just not equipped to handle that type of information, and unfortunately will probably get sued out there. But also, as far as testing goes, in addition to what Karen said, when you do COVID-19 testing for your whole workforce, this kind of falls under be careful what you wish for, because I had a client that did that and they had about 90% test positive, and they were all asymptomatic. So if you got a bunch of COVID-19 confirms, then they're not going to be able to work probably for about at least the next 10 days. So just be ready for maybe losing a lot of